And go ahead and take your camera, put your camera on.
Okay.
Thank you.
Yeah. Good morning. Thank you guys for joining us today. So we are on Thursday of our Disability in a Week. Can you guys still see my little spreadsheet or PowerPoint? I had to move it. All right. So there's been recordings for the previous week. So if today's your first day joining us, you can watch those when they're uploaded. Today, we have Dr. Whitney Griffin with us, and we're going to be talking about diagnosing and supporting college students with attention deficit or hyperactivity disorders. And if you're able, join us tomorrow, and we'll have a panel with Holly Wagner, myself, Renee Macemore, Jason Reisner, and Monica Isbell. We're going to be talking about requesting accommodations and the technical standards. This is put on with the Disability Services Advisory Board, and Trudy Hughes is our System Office Liaison.
Excuse me, Renee, we don't see your screen. We see a Zoom page. Sorry to interrupt.
I had like 3 screens. Can you see it now?
Yes, ma'am. Thank you.
All right. Yeah. Okay. Tuesday segment is our board chair. I am the treasurer. Jason Reisner is the secretary, and then our other members include Laura Bracken, Casey Grover, Amy Helmus, Lisa Kelly, Megan Sherman, Starvot, and Holly Wagner. And some just housekeeping reminders. We ask that you please hold all your questions until the end of the presentation. Mute your mics during the presentation. Each session, you'll use the same link. So tomorrow, if you join us again, use the same link that you've already been sent. And then at the end of the week, you'll receive a survey, and we ask that you please fill that out. And then, as always, you can reach out to anybody on the advisory board with any questions or concerns. And now I'd like to welcome Dr. Whitney Griffin. She's a licensed psychologist and clinical assistant professor at the Psychoeducational Clinic at North Carolina State University. In this role, she conducts comprehensive psychological and psychoeducational evaluations of students from elementary school through college to better understand their learning needs and provide relevant recommendations to support these students and their families. Dr. Griffin also provides supervision, support, and training to graduate students in the school psychology program at NC State. She earned a doctorate in school psychology at NC State University and also holds a master's degree in special education from East Carolina University. Her interest includes autism spectrum disorder, intellectual and developmental disabilities, hearing loss, and the social emotional development of children, adolescents, and young adults. Whitney also serves as the educational specialist at the Carolina Institute for Developmental Disabilities in Chapel Hill, where she provides consultation and educational assessment services on interdisciplinary teams, while also mentoring graduate students in the maternal and child health leadership education and neurodevelopmental disabilities program. Prior to becoming a psychologist, she worked as a special education teacher and autism specialist in the public schools for over a decade. So I'd like to hand it over to Dr. Whitney Griffin, and welcome.
Thank you, Renee. And I'm going to see if I can share my screen here now. I think 1 second. All right. Can you see my slides now?
Yes.
Great. Thanks for having me. As Renee said, I'll be talking about diagnosing students with ADHD and supporting them in the college setting. So the goals for today will be for you to be able to identify common features of attention deficit hyperactivity disorder, ADHD, learn more about the steps that are involved in the process of diagnosing ADHD. We'll talk a little bit more about how this might impact learning and participation. in the college setting, as well as some accommodations and supports that would be relevant for these students. And I know many of you already probably are using a lot of these great strategies. So as I mentioned earlier this week, if you were in the session about learning disorders, you may or may not have been. And I understand another presenter has touched it quite a bit on this week. There is a move away from talking just about disorders from a deficit model only, but rather to conceptualize some of these differences as part of the diversity of people. So thinking of this more rather than just a neurodevelopmental disorder, but as a neurodevelopmental difference and part of neurodiversity. But I also will be talking about the diagnostic process. And of course, that process still relies quite a bit on understanding more about areas of difficulty. So I will spend some time talking about the areas of difference that are also challenges. But ADHD is known as a neurodevelopmental disorder or neurodevelopmental difference. And the diagnosis here is based on difficulties with attention and or hyperactive and impulsive behaviors. The difficulties should have been observed prior to age 12, and there should be some documented difficulty across at least 2 settings. So the characteristics of ADHD fall within 2 major domains, particularly when it comes to that diagnostic process. There are symptoms that are considered the inattentive symptoms, and they range from just difficulty with sustaining attention or distractibility to trouble attending to details, tendency to make careless errors. Someone that you might be talking to, and then it seems like they're not really listening, having trouble following through with instructions, even when they want to do what they're supposed to be doing, or trying to accomplish tasks, difficulty following through or completing things. We can see a tendency to avoid or dislike activities that require sustained mental effort. And then also there can be difficulties with organization, mental organization, kind of disorganized, a difficulty with kind of planning and organizing thoughts, as well as physically keeping materials organized, losing materials, forgetfulness. And then the hyperactive and impulsive symptoms range from the more fidgeting, frequent movement, restlessness, difficulty staying seated, difficulty engaging in activities quietly, and this just kind of being always on the move, on the go. To verbal activities, so being very, very talkative, excessively talkative, difficulty stopping talking, a tendency to maybe go on and on. And then also some impulsive behaviors with talking or with physical behavior. So blurting out, acting before thinking, trouble kind of waiting, a tendency to maybe interrupt or intrude on others, or engage in behaviors that tend to be a little bit more disruptive. Now, you don't have to have every single one of these characteristics to get a diagnosis, but there needs to be a certain number of difficulties in one or both of those areas. So if you've been around for a while, or even if you haven't, you might be familiar with the term ADD. People throw this term around, ADD. I'm ADD, or that's ADD. I'm wondering, just a quick check-in here in the chat box, if you know what the difference between ADD and ADHD is, or why that's different, why ADD, ADHD, if you feel that's familiar to you, know a little bit about that change. Enter a 1, so that's a yes, and a 2 if you're not quite sure. You've heard of that, but you're not quite sure why there might be some difference there. Great. Okay, a lot of people. Give that just a couple more seconds. All right, it sounds like most people are familiar with this change here, that we used to differentiate ADD and ADHD, and now the most recent iteration of our manual that we use for diagnosing, the umbrella term is ADHD. And then the actual diagnosis can be a more inattentive presentation. It's still ADHD, but you can be just an inattentive presentation, just a hyperactive impulsive presentation, or both. Do I see someone who only shows difficulties in one of those areas, but it's about what's predominant? So is it predominantly inattentive, predominantly hyperactive impulsive, or a good mix of both of those areas of difficulty? There's also other features of ADHD that aren't necessarily part of the diagnostic profile, but things that we see very commonly. One of those is that these students can tend to be easily fatigued. They're working harder than they're typically developing peers to stay focused, to sustain their attention, and they can tend towards getting a little bit more fatigued because of that additional effort that they're spending. Some clinicians and researchers also think of ADHD as a kind of dysregulation in alertness and arousal levels. So while we typically would awaken in the morning and have kind of a spike in our alertness that would sort of gradually decrease through the day, and then we settle down in the evening and get ready for bed. So we kind of have this alertness and arousal level that goes like this. Folks with ADHD can sometimes their arousal level and alertness can wax and wane through the day. So it's a little dysregulated and not always at the times that they need to be attending or they focused. So if you work with these kids, you might be talking to them for a while, and then all of a sudden they're really there with you. They're quite engaged in conversation, and then kind of tuning out. And not actively tuning out, but they just sort of lose this energy and stamina and arousal. Very common in folks with ADHD is difficulties with executive functioning. So that relates to their ability to kind of get started on tasks, to initiate tasks, that organization piece, keeping their materials organized, organizing their thoughts and presenting them in a way that's clear and easy to follow rather than kind of jumping off on tangents. Organizing time, so managing their time, keeping up with what they need to do, being reasonable and what can be planned and accomplished within a period of time, and planning ahead to make sure tasks can get done. The ability to shift focus is an executive functioning, so going from one thing to another in a helpful way, in a focused way. So certainly folks with ADHD might shift focus too much, but being able to actively have effortful control over the ability to focus within one area and then shift to another. And there can also be difficulties with emotional regulation. So some folks with ADHD can have kind of bigger emotional reactions, a little bit more difficulty kind of managing their emotional responses, and might get very overly upset, or they're a bigger upset in a situation where others might view that context as something that shouldn't be that upsetting, but they might have a bigger reaction. And sometimes folks with ADHD have difficulty recognizing the impact of their behavior on those around them. And there are certainly co-occurring difficulties often we see in learning, and there can be a co-occurring learning disorder diagnosis in folks with ADHD. Now, I said there's a shift to not focusing only on areas of difficulty. So we certainly do see strengths in all kids, including kids with ADHD. We don't have necessarily a clearly mapped out profile of here are the strengths that we will consistently see. But I will say a misnomer is that students with ADHD can't focus on anything. They certainly can focus. Sometimes they can really hyper focus on an area that's a really strong interest, or and that can become a strength. If there is an area of interest and they channel their energy and focus into that, that might be something they can become quite knowledgeable about. A lot of folks with ADHD are creative and really think out of the box. Sometimes those with really high energy level are able to channel that energy into a passion, or something that's physically active that they're really actively engaged in. And a lot of folks with ADHD, as they get older, sometimes by college age, have developed some really nice compensatory strategies. So some kids will come into school with some good strategies for managing their, compensating for the missed information and managing their time. And they might have developed some good strategies that other students might benefit from having, but they've been kind of forced to do that a little bit earlier on because of some of these challenges. So now typically an ADHD diagnosis is made by a psychologist, though medical providers may also make this diagnosis. In the clinic setting, the process, not every clinician is going to do this exactly the same, but the process typically would involve gathering developmental history. So, and not just developmental history, but a social developmental history. So understanding a little bit more about not only the child's early development, but maybe their family situation and circumstances, other things about their health and medical needs. Because all of these are going to inform us as to kind of their profile and trajectory, as well as other areas of difficulty or adversity they may have experienced that could contribute to difficulties with focusing. We'll want to do some kind of a record review. Often this is another source of information. I'll often look through report cards to teacher comments, and I'm looking for comments about needing extra help to sit still, or to get assignments done, or to stay focused. Sometimes that can be found in old records. Certainly interviewing is an important part of the diagnostic process, both with a parent or some other caregiver or person involved in that child or individual's life, as well as with the person themselves. Not everybody with ADHD has great insight, but a lot of kids do, and a lot of kids can give you more information about their sort of internal experience, and we'll talk a little bit about what it feels like in class and things that are hard for them, and strategies that they've tried. So it's always a good source of information. Then a very common part of the diagnostic process is gathering rating scales. So there are parent rating scales or parent caregiver rating scales for teachers, and then there's self-report rating scales that individuals can complete. And then what you won't always see as a part of the diagnostic process, sometimes if it's done maybe by a medical provider, but what you'll see more often with clinical diagnosis will be some direct assessment of attention-related capabilities or other attention-related skills, the ability to stay focused for a lengthy period of time, the ability, and some of those related areas that can be impacted in ADHD. So those executive functioning skills, the ability to shift focus, to sustain attention while also being given another cognitive challenge. So there's some different tasks and things that we can do in clinic settings that enable us to generate some standardized scores and compare a child's skills and abilities in that area to other folks of similar age. So the direct assessment process might include direct assessment of attention, assessment of executive functioning. We also will often look at memory and different aspects of processing. These are areas that can be impacted when there's attention weaknesses. If you're struggling to attend, then it's hard to remember things. If you didn't get them, if you weren't attending to them in the first place, they're not going to get very well put away into memory. So sometimes we can see folks with ADHD have difficulty on memory tasks, and that's another piece of information that might help inform us. We will sometimes do a full cognitive assessment to look at an overall cognitive profile. And this is helpful not only for looking at kind of areas of variability, areas of potential strength, as well as areas of potential difficulty and difficulties that might overlap, because we can see difficulties on working memory tasks and processing speed tasks for folks with ADHD. But we're also maybe ruling out that there might be other areas of difficulty that could also lead to trouble with sustaining attention. And then an academic assessment is not always a part of the diagnostic process, but it certainly can be very helpful when we're wondering what the educational impact is, as well as, again, to rule out other difficulties. So ADHD and learning differences or learning disorders can co-occur. And they can overlap. So, if you're having trouble attending, then that can affect your ability to engage and participate in instruction, which can negatively affect learning. If you have kind of some underlying skill weaknesses and difficulties with learning, then it can make that much harder, much more effortful for you to participate in instruction, which can fatigue you, which can then make it hard for you to focus. So your focus can be implicated in that way as well. So there's a good overlap there. So academic assessment can be helpful to kind of better understand strengths and areas of difficulty. So just some of the rating scales that you might see when you get, say, a report come in where someone's made a diagnosis or gathering some updated information about a child's skills. Some of the common rating scales used in looking at ADHD, particularly some of these more in children and some of these up through adulthood, include the Conners 3. The BASC is a more general rating scale, but has some attention and hyperactivity, impulsivity scales. One for children is the Child Behavior Checklist, the CBCL. The BRIEF is an executive functioning rating scale, and that can be helpful to understand a little bit more about the profile. And the Brown scales also look at attention and executive functioning. There's a little bit newer one, the Comprehensive Executive Function Inventory, that goes through adulthood. What I see a lot from medical providers is the Vanderbilt scales, which tap into some of those main criteria that I went over with attention and hyperactivity, impulsivity symptoms. So this is kind of a symptom scale. Some of the direct assessment tools that might be used include the CPT-3. That's a continuous performance task. It's the Conners continuous performance task, and it's a 20-minute visual presentation of stimuli. There's letters that are flashed on the screen, and you have to press the space bar after every letter except for one target letter, and it's boring and not too easy to keep your attention on it for anyone. But there are, a set of standardized norm reference scores that give some indication of your ability to stay attending to that very boring task over time is if you have even more difficulty than what might be expected for what's kind of typical in the population. A similar task, the CATA, is sustaining attention to auditory stimuli. The TEACH 2 test of everyday attention for children, that's a little bit, well, it's not that much newer, but maybe I see this one used a little bit less frequently. There's some executive functioning assessments, the DCAFs, can be used all the way through adulthood. The NEPC is for children, so you might see that on older reports, or maybe if someone's last evaluation was kind of early high school, but won't use that for older adolescents and young adults. And then there's certainly quite a few assessments of memory and attention and that whole functioning process. So the RAML is one of those, the CHAMP, the Children's Memory Scale, and there's another related scale for adults. So these are some of the tools that you might see used as part of that evaluation process. Then, as I mentioned, if we're doing even a more comprehensive evaluation and looking at cognitive and academic functioning, these are some of the tools that you might see there. The WAIS is the Wechsler Adult Intelligence Scale that you'll see for ages 16 and above. For younger folks, you might see the WISC, which is the compatible intelligence scale for children. The DAS, the differential ability scales, those go up to age 17. So you might see those in reports for folks who had evaluations, a little bit before coming on. There are also, you may see clinicians use a nonverbal test of intelligence, particularly if there may be any co-occurring concerns about language. And then these are just a sampling of some of the academic assessments that you might see used if there's a standardized academic assessment conducted as a part of an evaluation. So let's stop here and do a check-in. I have a case scenario here, and I'll let you read that to yourself, but I'm also going to read it aloud just for anyone who might need to hear this, and then ask you a question. So Bill and his parents are concerned that Bill may have an attention problem. He's in 11th grade and is really struggling in his advanced placement history class. There's so much information covered in the class and he just cannot seem to remember it all. He is finding it especially hard to focus in class and often finds his mind wandering. As a result, he is missing some of the important information in class. He tries to take good notes, but because he is becoming so easily sidetracked, some information is missing. He admits that his notes are also a bit messy, so he sometimes simply cannot read what he has written. He has never needed to study much, but Bill emphasized that he is taking time to study for his quizzes and tests, and he will think he has a handle on the material after studying. However, when he gets to the test, it's like his mind goes blank. He can remember some details, but it's taking him so long and he's running out of time. So given the information here, if you think this clearly seems like a case where we might be making an ADHD diagnosis or might be headed in that direction, enter a 1. And if you have some questions or feel like there's maybe some missing information, enter a 2. And if you're going to enter 2 and you have anything that you see that's missing or are wondering about, you can enter that as well. And I'll give that just a couple of minutes, or maybe a minute to see some responses here. Great. Okay, so I see a couple more comments are coming in here. Great observations, everyone. Now, certainly, this isn't a case where I would say, no, there's no attention issue, but we are missing some history. So first, to make a diagnosis, we need to know that there has been difficulty, at least some kind of difficulty. You might only get that through interview data, but you might see it in a record review of prior to age 12. Secondly, we need to see difficulty across settings. And right now, this presenting concern is within this one class, and it's within this one challenging class. This is based on several cases that I have seen. Parents sometimes wonder and worry about attention difficulties when a child starts struggling, and they haven't been prior to that. So, and there can be a lot of reasons for that. Yes, sometimes we do see kids with attention difficulties who are very bright, do compensate pretty well for a while, and eventually they kind of hit a point where they didn't have some good strategies in place, and it starts to have a little bit more impact. But you would need a lot more information to make that call here. In this case, there are some other things that might be going on. We don't know how this student is studying for and preparing for these classes, and he admittedly, doesn't have a lot of practice with doing that. So we would need some more information there. This is a challenging class, so it may be new for him to experience this level of challenge, and hard for him, and he may be having some anxiety here. So some of the things here suggest there might be some performance anxiety, some anxiety about test taking. And I'm not saying something that I might diagnose. I might or might not, but he's experiencing some stress here. So, but we would certainly need more information to ultimately make that call about a diagnosis here. Great observations. So here's one more case scenario, and I'll read this one out loud. Lynn is in the 7th grade and she is really struggling in school. She barely passed her classes her 6th grade year, though she did well on her integrate exams. Although throughout middle school, she has had multiple missed assignments. This year, her parents started sitting nearby during homework time, and though it takes her a long time to complete her homework, they think she's getting most of it done. However, somehow the work is not making it back to class. She's currently making C's and D's in most of her classes, though she has maintained an A in art. Lynn seemed to do okay in elementary school. Though her parents do remember her 5th grade teacher checking in with her quite frequently and working with her at the end of the day to make sure she had all her materials. Her elementary school teachers did not express major concerns about her behavior. They usually commented that she was so friendly and sociable, but sometimes she needed to cut down on the social chit chat. Since middle school, Lynn has not been keeping up as well. She participates in class, seems to understand the content. She does not always finish the classwork. Her English teacher noted that she could get more done if she spent less time talking to her friends during class. Okay, so we'll have the same response options there. One is if you see this, seems like we've got some information that might be leading us in the direction of an ADHD diagnosis. And 2, if you're not quite so sure about that, or maybe there's some other areas that you'd want some follow-up in. And I'll wait about a minute here to have some of your responses come through. Okay, great. So I give this example specifically because Yes. Now there may be some missing information. There's always, in a case scenario, going to be some places where we would need to follow up, right? But there's certainly a lot of information here that would make me wonder about ADHD. Transitioned into middle school, or we've transitioned into high school, and great. I have another comment here, and I'll address that. So the level of independence and engagement in those executive functioning skills at those transition points into middle and into high school is often where some kids who have some difficulties in there, it might become more pronounced. We also know that ADHD can look a little different in girls. I see someone is kind of wondering, maybe this is a kid who's just a social butterfly, and of course, that certainly could be the case. What we're thinking about here is functional impact, right? Are you such a social butterfly that you cannot keep up in your classes, and you're not functioning as well as you need to be in a particular scenario, because that's all of what you're doing. So sometimes girls can be less apt to be diagnosed because they are engaging in less of the disruptive overactive behaviors, and can tend towards some more social activity, lots of talking, lots of kind of off-task behavior, and disruptions that are less problematic, because there's not, it can be a more joyful disruption. But when we wonder about this as a diagnosis, we're thinking about what's the functional impact. Is it getting in the way? This family is distressed. We'd certainly want to talk more with the family, get some more information and background, and talk with this student and work with her and see what this looks like. But sometimes ADHD can look a little bit different in girls. I also another red flag or cue is when we've got poor grades in certain areas, but then maybe there's an area of interest and we're doing just fine there. So I wonder, is art the area of interest for the student, and is that why things are, or the class might be run a little bit different way? So there's some supports in place, or some ways that things operate in one setting that work well for a child. So great, I appreciate those comments. So we give a diagnosis, but what happens then? So I'm thinking here kind of before college age, because we're thinking about folks coming into college who may have had struggled or needed some support. Often kids with ADHD are, one of their areas of struggle is at school, and they might be eligible for additional support. So they may have received some kind of support in school. And so I'm going to talk a little bit about what that process looks like. In the school setting, though, they may not be making that diagnosis. Typically, they're not. And the focus in a school setting is more about eligibility for services rather than making a clinical diagnosis. So if you were here with me on Tuesday, I talked about learning disorders, talked about the difference between clinical diagnosis and school eligibility. Now, ADHD is a clinical diagnosis, but when a child with ADHD is struggling in school and we're trying to make a determination about whether they need some support there, then the focus in the school setting is not about making an ADHD diagnosis, but it's about determining, are you struggling with attention? And then is that affecting you in school in some way? So school psychologists don't usually make a diagnosis. Some of them can. We are licensed psychologists. We can make that diagnosis, but in the school setting, that's not your role to make a diagnosis. So usually there needs to be some outside provider making that determination. And in particular, to get services in the school in North Carolina, you also need a medical provider. So you need, even if I make a diagnosis, if a child is going back to school and going to seek services, they'll need to go to their pediatrician or a medical provider and, have that documented in some way. And sometimes they'll take a psychologist, a diagnostic report, and they'll say, yep, I'm going to give you that medical diagnosis as well. But the decisions in the school setting are guided by the state policies. So that policies governing students with disabilities in North Carolina, there's a particular document for that, and that's derived from federal law. And the focus is eligibility for services, not diagnosis. So if a child is coming to you from public school and they were getting special education services, the eligibility category that might have been considered for them would have been other health impairment or OHI. I'm not going to read through this, but this is just a definition of what that particular area of disability is. This is the definition in policies. And ADHD, you can see down here is a part of that. Another area of eligibility that might be considered if there's a great academic impact would be whether or not there's a specific learning disability if a child meets criteria for that. So that's when there's difficulties with listening or comprehension, oral expression, with writing, written expression, or those basic spelling skills, basic reading skills, comprehension in reading, or some aspect of math, the calculations or the problem solving skills. And so not only must they meet criteria for that particular area of eligibility, the definition there, but that it must be determined that that disability has an adverse effect on educational performance. So if a child has an ADHD diagnosis, if I give them, say in my clinic, an ADHD diagnosis, that doesn't mean they go right to school and they get an IEP, special education services. It also has to be determined that there's an impact on educational performance and that they need specially designed instruction to be able to participate in their educational program effectively. So here's that process, and this is the process that I went through for students with specific learning disorders. If you were with me on Tuesday, there's a need identified, an evaluation is done, and in the case of ADHD, they might also need to get some information from an outside provider, from a medical provider, and they make a determination about eligibility. And if that child, it's determined that that child is eligible for service, they'll develop an individualized education program or IEP. So you may see students come to college who have had an IEP, and that's going to have a wealth of information about the kinds of supports that were put in place for them and the kinds of goals they were working on in that school setting. So it's a helpful document. But not every student with ADHD requires special education services or gets them. But there's some other ways that students with ADHD are supported above and beyond just things that teachers might do informally. And one of the other main ways is a 504 plan. A 504 plan is based on civil rights law. Section 504 of the Rehabilitation Act, rather than federal special education law. And just for anyone who might, a couple slides, I have a couple of links just about 504 plans for anybody who just might want to read a whole lot about 504 plans. But this is an accommodation plan that would list accommodations and modifications for a child who has a disability in any particular area. It actually can be, it's a little bit more broadly based in terms of who's eligible for these types of plans. But the main difference here is that they don't require some specialized instruction, just some accommodations. And these often translate pretty well to a college setting. And some of the really common ones you'll see on these plans might be like extra time on tests, someone reading materials aloud. Sometimes you'll see ones with visual schedules or the opportunity to take breaks. So these are just some examples of what kinds of things you might see in a 504 plan. Here's those links that I mentioned from the Exceptional Children's Assistance Center, ECAC, and understood.org, both of which are good resources for information. So once we get to college, we might have folks coming in who have an IEP that they're bringing along with them. Not that you implement the IEP, but that's a source of information about their needs. They might have had a 504 plan. Though certainly you might have kids come in who don't even get that diagnosis until college. So then you won't, in those cases, you won't have that prior data or documentation. Before I talk about those challenges, though, just noting that we can certainly see strengths in college students with ADHD. Again, they might have that heightened focus in their areas of interest and a really strong knowledge base about the things that they're interested in. These kids can often bright and be quite creative thinkers, and their level of energy and involvement and enthusiasm for activities can really make them a great participant in the college setting in lots of different ways. So I don't want to miss that there are certainly a variety of strengths that neurodiverse kids can bring to a college setting. Oh, I see someone has a question here, and I will come back to that at the end, but I have a question about, actually, you know what, this is a good time. I'll address that really quickly. Someone has a question about qualifying for services under OHI through the response to intervention process. So technically, response to intervention is not required to meet that area of eligibility. It's about having the limited strength, vitality, and all the pieces of that definition. However, there is a shift in public schools now to determine if a child can be supported in the broader school environment through different kinds of supports. Without it necessarily moving to the level of special education. And the idea is that rather than having these siloed, here's the special education, here's the general education, and that's what we do, having the whole school think about, okay, how are we supporting kids learning? And how are we doing that in creative ways? We're gonna have some literacy specialists, and they might run some groups, and the teacher might have a small group here, or bring in some volunteers to work with kids in this way. And we might have an elective where we're gonna work on remediation of certain skills in the school. And then we also have the special education setting where we're really gonna get focused and set some goals and work with kids on things. So sometimes we might look at whether some of those other supports could be put in place for a kid. Say they have an ADHD diagnosis, and we're wondering, well, maybe they just need a little extra group for their reading to kind of keep them focused in that area. And we don't get to the special education process or the special education eligibility. So they could theoretically go through some of this process of trying an intervention, seeing how it works, and then determining whether they need something above and beyond. But it's not necessarily required for the eligibility in OHI, but you might see that because that might be how the school is operating. They're saying, this kid's struggling. Rather than give them a label right away, what other things could we do along the way to support them? And maybe we don't need the special education. So that's how that might work. It's a great question. Okay, so once we get to the college setting, though we certainly can have some strengths, we also can have difficulties for folks with ADHD. So certainly those core characteristics are going to be a source of some difficulties. These students can be easily distracted and sidetracked, and college can provide them a wealth of things to be distracted by. So sometimes they might have too many interests and activities that they're trying to be involved in, and maybe they've never really had to manage their schedule on their own, and it's fun. There's so many things, and they can get really overscheduled and have a hard time of balancing things there. So management of time can be challenging, and not just the academic piece, the social piece too, and those certainly can overlap. When we have too many social activities, then we don't leave time for the academics. And if we don't do well managing the social piece, we can take away a good source of support. So managing both of those things can be really important for students, for all college students, but certainly students with ADHD. They can have trouble planning ahead that time for studying, as well as when they're given maybe a bigger project, knowing how to break it down and kind of tackle it one step at a time. They can become a little bit overwhelmed. Certainly we can see that disorganization piece with materials, with their living and workspace for folks who are not living at home anymore, learning to manage their own workspace. But when they are living at home but are trying to find other workspaces that work for them, like the library or certain spaces within the college, they sometimes don't manage that well. And then that the organization in terms of their thinking and task approach, the work that's produced, can sometimes, especially we can see this sometimes in writing products, and they might kind of jump from topic to topic or idea to idea without having a good flow. Certainly, sometimes we still do have some of those hyperactive, impulsive behaviors get in the way in college. Sometimes these behaviors are a little bit more toned down the older kids get, or if they've been particularly problematic, they may have found some medication management that works well, but you can see some blurting out, some fidgeting, and then just some difficulties with social appropriateness, not knowing when it's a good time to share information and share anecdotes, and when it's a good time to sit back and be quiet. And different instructors can have different class cultures in which the participation might work a little bit different, and that can be hard to learn how to navigate if you already have a little difficulty in settings. And then certainly there can be other co-occurring conditions in ADHD. As I mentioned, learning differences. There's higher incidence of things like anxiety, depression, and mood disorders, substance use and or abuse, sleep disorders, and if you're not sleeping, you cannot focus very well, and it's gonna affect your learning. There's also a higher rate of tics and Tourette's syndrome, and some of these issues can emerge at times of stress, even good stress. So that transition to college is a time where we might see some of these things, if they were there before, kind of flare back up or start to emerge. So what are we doing about that in the college setting? The three most common intervention or strategies I see with folks with ADHD are extra time, separate setting for tests, and copies of notes. And I think those we see those on 504 plans all the time, and those are usually pretty easy to do. I know sometimes our kids with ADHD are not always registering in time, or doing, if there's some pre-planning they have to do to get set up for the separate test or for the extra time, sometimes they're having trouble with that follow through. But these are some pretty common accommodations that are made. But there are other areas that can be helpful. We're not always going to be able to get these put in place depending on the course content and the requirements. But sometimes, because these kids are prone to careless errors, giving them an opportunity to revise and resubmit when instructors will do that can make a big difference, especially if they're willing to make any grading considerations. We've got lots of careless errors in work and spelling errors and things like that, and we have a really harsh instructor who gets kind of focused on that. But if we could kind of separate that, or think about what have we got in terms of ideas there to show understanding and knowledge of this particular content area, might we back off or limit or even separate, like here's the grading here, but here's the grading on the content. When that can happen, that can be helpful for folks with ADHD, as well as just having clear expectations from instructors. And I think a lot of them are required to have, a syllabus and specific details and information about projects, but the clearer the better, certainly. And then I talked about some interventions for folks with learning differences, and there may be some additional supports that need to be put in place if there's specific academic skills difficulties, access to a writing center, support materials like calculators or dictionaries, word processing, some of those assistive technologies we talked about, being able to the word, e-readers or audiobooks or word prediction software, spell check, those kinds of things can be helpful for catching those careless errors or helping with some of that work output. And then in addition to tutoring in academic areas, there's some research and interventions coming out that suggest it can be helpful to provide coaching and support related to some of those executive functioning areas, study skills, time management, self-regulation, being able to set goals and stick to them. So there's some programs out there that can be helpful, and either through the academic support programs. I know there's quite a few programs that offer some things like this. There's folks in the community who do like ADHD coaching, and there's some mixed research here, but some evidence to suggest that this can be helpful. And certainly, I think with folks with ADHD, like just getting set up at the beginning of the year sometimes isn't enough. Having a more frequent check-ins. Sometimes they know and they can tell you what they need to do, but it's that application that they're really struggling with, and they need someone kind of giving some of those extra prompts and extra reminders. As with kids with learning differences, they might need, preferences with course selection, help with selecting their course sequence. There's some evidence also in using mindfulness strategies with folks, college students specifically with ADHD, that can help with some of that self-regulation and focus. So, I included in the list of readings and articles, I just a sampling there, but there's one about mindfulness that I thought some of you might find interesting. So these are just a few select areas that are good sources of information. Teresa Maitland who works at UNC, or used to work at UNC and has been in this field for a long time, has come out with some books that I think are great resources for families, students, and these are just a sampling of some readings that I thought might be helpful. I see we're coming up to the end of time here, but I can stay on and answer any questions. So I'll kind of open it up to questions now. If anybody has any.
Participants have the ability to unmute yourself so that you can speak directly instead of putting it in the chat, or you can put it in the chat as well.
Hey, Dr. Griffin, this is Eric at South Piedmont Community College. How are you?
Hi. Hi, I'm good, thanks.
Good. I'm just curious what your thinking is, or what the general thinking is on how ADHD is viewed in terms of its longevity through lifetime. Is it pretty much considered a lifelong disability that really can't be cured? It really just becomes more of a management strategy approach?
That's a great question. So ADHD is considered a neurodevelopmental disorder, and neurodevelopmental disorders are not expected to go away. Mm-hmm. They're expected to be lifelong, but they're also don't necessarily look the same throughout the scope of life. So as I mentioned, sometimes, for example, the more kind of hyperactive or overactive behaviors that might have been quite disruptive earlier on, sometimes that can shift to just being a little bit more about restlessness. Sometimes we can see in younger kids some more behavioral challenges, oppositional behaviors and things, and sometimes those behaviors are not quite as intense as folks get older. And then, folks with ADHD absolutely can learn strategies to manage, so they can be very successfully, gainfully employed and, happily engaged, with the right kind of strategies in place. So, and I see that all the time, and I see parents come in with those strategies, and now they're seeing some similar difficulties in their kids. So, there is going to be a little bit different way that they're wired, ideally also using some strengths to their benefit and, pursuing vocations that are, good fits for them. But yes, it's not necessarily expected to go away. Certainly theoretically, if someone, is really mild, or maybe they found a really good medication regimen, that, maybe it would be, you wouldn't see it. Maybe they might, the criteria, it would be harder for them to meet criteria if they were going to get a reevaluation or something.
I see.
Thanks.
Thanks for your feedback on that.
Dr. Griffin, I have a question. This is Amy Helmus. So specific to maybe ADHD coaches, is that a recommendation that you think would be good for individuals with that diagnosis who are transitioning to college or in college? And if that is something you think is a good idea, do you have some resources available that you might share, or if you know of any resources?
Sure. So there's yes, I do think that it can be helpful. I think the research is still a little mixed. So, it's, for folks who go in who are really motivated to learn skills and try to apply them. We have a coaching program here at State. It's called ACES, Academic Coaching for Educational Success. And we do that with middle school through college age. And I see it be really helpful for some students. And then some students, they, especially it lasts more with younger students, sometimes even weekly is not enough. They almost need like a daily check-in. So there are folks in the community who do that. And I guess it would depend where you live. There's an online program that I've recently come across. I think it's called Beyond Booksmart, and it's like a virtual coaching, and I've suggested that to some families to just check into it. But I see mixed success, but if a kid is struggling and you've put some other things in place and you're looking for something else, I think it's something worth looking into. Some folks are using strategies kind of based in the principles of cognitive behavior therapy, and that's when working on some of the self-regulation kinds of skills. So there could be just therapists or psychologists out there that are doing that kind of work. But if you want to send me an email and let me know where you are, I'll let you know if there's any.
Okay, that's great. I am in the Wilmington area, but I will certainly send you an email.
Yeah, send me an email. That'd be great.
Thank you.
Dr. Griffin, can you speak to, as a psychologist, how you determine the difference or the primary diagnosis between ADHD or anxiety? Because they do, if they co-occur a lot, which one might be impacting the other, which one's more prevalent, or how they impact each other? Yeah.
That's a great question. It's very hard to do. We don't, have a blood test or brain scan, that gives us definitive information. But before I answer that question, I did want to point out to the comments that someone's offered a resource related to that prior question. Anxiety and ADHD do co-occur, and they do manifest. There's some overlapping symptoms. So I will look at history and look at what early symptoms might have looked like. I will look at gathering some information and data from teachers. And then, some of it is clinical judgment and making a suggestion about, let's target this first, right? So, if I'm more inclined to think there's some anxiety rooted there, I'm going to suggest let's work on the anxiety first. Let's get some interventions in place. So the cognitive behavior therapy is one of the more researched areas of intervention for anxiety disorders. And then there's medication, of course, to help support anxiety as well. So I might encourage a family to seek out some support in that area. And then when we tackle that, then we might revisit, okay, are we still struggling with the attention piece? And so we might have a couple of steps in that process. And that's not, we don't do medication and intervention to make diagnostic decisions, but sometimes that just going through that process can kind of help narrow it down. And I'm often more inclined to treat the anxiety because I'm a little bit more worried about what not treating that would look like than the attention piece. So that might be the place that I would encourage the family, like, well, let's start here, and then let's move. And if it seems like they're both pretty equally impactful, we might go ahead and go two-pronged. Let's target them both, and then we can kind of step back and revisit again in the future.
Thank you.
Mhm. Any other questions? Neurofeedback. Neurofeedback does have a good bit of research behind it. So, when something is research based, I will encourage a family to follow up in that area. Neurofeedback, for those who might not be familiar with it, is an intervention that it's kind of hard to explain, but it involves kind of helping a person tune into their what's going on in their body and kind of working on calming themselves, using some self-calming strategies while they're kind of given some simultaneous feedback about their brain functioning. And there's some research to suggest that can be helpful. There's some, I think, a follow-up from that. I had a family who their kid had a watch. And after they had learned like some tools to kind of tune in and focus on things, their watch would kind of remind them to engage in certain strategies sort of periodically throughout the day. And they were seeing some good success with that. So yeah, not typically something you have available at a college setting, but that a family might, or a student might seek outside. Any other questions? Thank you, everybody. Thanks for having me, Trudy.
Dr. Griffin, thank you very much. Wonderful job. And this is information that our colleges will really benefit from. I appreciate you spending the time with us both days. It was phenomenal. I did have a question. I was wondering, I will be sending out the evaluations on Friday.
Mm-hmm.
I was wondering if you needed that for your P&T. Any evaluations would be helpful, or
I think